Optometry Australia's National Eye Health heat map highlights that in metropolitan areas, eye health needs are very well met. However, in inner and outer regional areas, there are significant areas of unmet need, and this is a concern for preventative eye health for Australians. We've had problems with cuts to Medicare funding for optometry since 1st of January this year. And that means that there are disadvantaged communities for whom it is much more difficult for an optometrist to provide services at low cost, if need be, to meet community need. If a patient is unable to afford an additional out-of-pocket expense for an optometric service, it means that the optometrists themselves must foot this expense, and that threatens the viability of certain practices around the country. The role Medicare and the Australian Government has in this is that since the 1st of January this year, optometry funding has suffered cuts. Because of this, there are areas in Australia dependent on demographic and social factors that are at higher risk of unmet need because of ability to afford optometric services. If a patient is unable to afford an additional out-of-pocket expense for an optometric service, it means that the optometrists themselves must foot this expense, and that threatens the viability of certain practices around the country. Over 12 million Australians have long-term eye conditions, and while 80% of vision problems are preventable or treatable, it absolutely makes sense for the government to invest funds back into optometry Medicare funding from a long-term preventative health point of view. The economic cost of vision loss is enormous. Most recent figures pitch it at $17 billion, and it's growing by $1.36 billion per year.